Doctors still overprescribing antibiotics? The Chart, CNN.com blogs. Edition, U.S. International, Mexico. Arabic. TV, CNN. CNN. CNN en Español. HLN. Sign up. Log in. #HDR editions A text decoration : none. CNN _HDR editions text align : left clear : both. CNN _HDR editions A text decoration : none. Font size : 10px top : 7px line height : 12px font weight : bold. HDR prompt text B display : inline block margin : 00020px. HDR editions Lee padding : 010px. HDR editions Alt Lee. Notepad left span font size : 12px. HDR arrow international. HDR arrow us. HDR arrow us to left : 148px. HDR arrow us to left : 180px. HDR editions A.CNN _HDR edition OK position : static color : FFF. Home, TV and video. CNN trends. U.S. World. Politics. Justice. Entertainment. Tech. Health. Living. Travel. Opinion. iReport. Money sports. Dr. Sanjay Gupta. Children's health. Expert Dr. Q&A. Sleep. Sex and you. Triathlon challenge. Brain and behavior. Cancer. Healthy eating. Psychology. October 3, 2013. 12:00 p.m. at. Share this on Facebook, Twitter, Dell.issue.us, Reddit. Misspace. Stumble upon. Doctors still overprescribing antibiotics. With all the talk of superbugs and antibiotic-resistant bacteria, you might think prescriptions for unnecessary antibiotics is relatively infrequent, especially for conditions where these drugs rarely work. New research from Brigham and Women's Hospital in Boston suggests the opposite. Dr. Michael L. Barnett, lead author, Honda. Dr. A. Jeffrey A. Linder, senior author, found that prescriptions of antibiotics for sore throat and acute bronchitis are far more common than they should be. You have a viral infection for which the antibiotics are not going to help, and you are trademark putting a chemical in your body that has a very real chance of hurting you, Linder said. Side effects of antibiotics include diarrhea, vaginitis in women, interactions with other medications and more serious reactions in a small number of people. Also concerning, when you take antibiotics, there's a chance the disease you're fighting, or other bacteria in your body, will mutate, making it more resistant to antibiotics in the future. People may have infections that are harder to treat down the line because we're overusing antibiotics today, Linder said. Disturbingly, says Linder, if you have taken an antibiotic recently, there is a measurable amount of antibiotic-resistant bacteria on and inside you. It's not possible to say any particular person is going to end up with an infection that's resistant to antibiotics because of taking these drugs. But science has shown that community levels of antibiotic use are related to rates of antibiotic-resistant bacteria, Linder said. Results from 2 studies by Linder and Barnett were presented at AID 2013, a meeting of health professionals, this week. Sore throat. In a research letter published in the journal JAMA the Internal Medicine, the researchers showed that while only 10% of adults with sore throat have strep, the specific condition requiring antibiotics, doctors prescribed antibiotics in 60% of sore throat cases. The study authors used data from large nationally representative surveys of ambulatory care in the United States: A National Ambulatory Medical Care Survey and the National Hospital Ambulatory Medical Care Survey. The surveys are sources of information on physicians and their practices. Linder and Barnett analyzed data from 1997 to 2010 for more than 8,000 sore throat visits, from patients who did not have injuries, immunosuppression or other infectious diagnoses at the same time. Based on this information, they determined the physicians have been prescribing antibiotics in about 60% of sore throat visits since around 2000. They also found that prescriptions for penicillin, the choice antibiotic for strep throat treatment, held steady at 9%, while the more expensive alternative azithromycin has been prescribed more and more. In 1997 to 19